Hello, welcome back to my channel. In this video, I'm going to be answering a quick question, and that is if emergency contraceptive use will actually increase your chances of having cryptic pregnancy. Now, somebody actually dropped this question for me, and I have responded, but I feel like I'm going to kind of say it here so that others can learn from me. Now, emergency contraceptive pills are actually drugs that you use when there is an emergency and there's a need to use it. It is not a regular drug that you take every day or every other day. It is something that you use when there is an emergency. Maybe you went to see your partner, you were already intending for conception, you weren't intending for any sexual contact, and then all of a sudden it happens, and then you need to take that emergency contraceptive. It's not something that you deliberately plan to take all the time, and then in a single cycle you're taking emergency contraceptive like 3, 4, 5 times. No. So emergency contraceptives are only meant to be used when the need arises, when there's an emergency, and that's the only option you have left. But if you need to plan sex, then you need to really check for other means of protecting, maybe like the barrier method of contraception that will help you avoid the risk of side effects associated with using emergency contraceptives like Postinor 2. Now back to the question, if emergency contraceptive can actually increase your risk of having cryptic pregnancy, the answer is no. In one of my videos where we talked about those who are most prone to having cryptic pregnancy and people who can actually have pregnancy that we go unnoticed, we talked about those on family planning, maybe on the implant, on the IUCD. And the reason for that is the fact that if you're on family planning, you will not have any thought of pregnancy. Like, all you have in mind is that you're on family planning, you're protected, so you wouldn't be expecting pregnancy. So if eventually pregnancy happens along the line, you wouldn't really know. So it could go unnoticed for a particular period of time before you eventually get to find out that you are pregnant. And then for people that just gave birth, they might not really know they are pregnant on time because they just gave birth. Maybe their normal cycle have not even returned, and then pregnancy just slip in, and they wouldn't even get to know they are pregnant until maybe after a long period of time. And then another set of people are people that are a bit obese. These people can also have this cryptic pregnancy, and it can easily go unnoticed because of their weight. So if there is a little change in their weight, they will still not get to know because they already are obese. All right, so these are some of the people that will have cryptic pregnancy go unnoticed, maybe for a long period of time or for a while. But for you who uses emergency contraceptive pill, so if you actually had an unprotected contact and you took an emergency contraceptive before the 72 hour elapses, that's, you're meant to take between 12 to 72 hours. So if you took within that range, then there is a high chance that pregnancy will be prevented. But if for any reason you are afraid of pregnancy, and then you feel like it could be that you were pregnant and it's a cryptic pregnancy, maybe because you're feeling like maybe you're having pregnancy symptom that might be a symptom of something else, and for the fact that you've had an unprotected sexual contact and you do not want pregnancy, you're not intending for pregnancy, you've took emergency contraceptive pill, you could actually get worried, like, what if pregnancy has happened and I don't know. And for cryptic pregnancy, most times someone can be getting her period, which is actually not a real period. It's actually a pseudo menstruation, something that looks like your period but it's actually not your period. That is a pseudo menstruation, and that's what you keep getting with cryptic pregnancy. So you might be feeling like, okay, maybe despite I took the emergency contraceptive pill, it didn't work, and I might be pregnant and I do not know. And then what if the 9 months elapses and I give birth to a baby? So you might actually be afraid because you've actually done this and you are not prepared for carrying a baby, so you can get worried. But for me, I will advise you to rest your mind. Now, cryptic pregnancy is rare. It happens in 1 out of every 475 pregnancy. So maybe for sure you've had unprotected contact and you have taken this emergency contraceptive pill. So I feel like you should rest your mind. You don't need to worry too much. The risk of you getting pregnant with the emergency contraceptive is there. But trust me, it does not increase your risk of having cryptic pregnancy. And for the fact that you're getting all of those signs that seem like pregnancy symptoms, they might just be your PMS symptoms, because after the fertile window, the next phase is the menstrual phase. And then while the phase is coming, you could be getting signs and symptoms that might seem like they are pregnancy signs and symptoms. And this is what most women who are trying to conceive sometimes get and may mistake it for pregnancy symptoms, or may think that they are pregnant, while in the real sense it's actually the premenstrual symptoms. All right, so these symptoms can actually seem like pregnancy symptoms, and you might get worried that you're getting it, and then you might think that, what if these symptoms are actually symptoms of pregnancy, and this pregnancy is a cryptic pregnancy and is not showing. So the chances are very rare, and the fact that you're using emergency contraceptive pills do not increase your chances of having a cryptic pregnancy. So you need to relax your mind. You need to just keep your mind at rest. Everything is okay and you will be fine. So guys, that is it. Thank you for watching. If you need other videos on cryptic pregnancy, just check in the description box and you can watch as much as possible. If you've not liked, if you've not subscribed at this point, please do so. Drop comments and I'll respond to them. If you have questions, feel free to drop them. I'll respond to them as well. Thank you so much for watching this video. I'll see you again in the next one. Bye.